So tell us about telehealth, because I feel like COVID really awakened us all to the possibility that you can do telehealth and it can work. But you've been in this for a while. Tell us about what you're seeing in the telehealth industry since COVID and the type of growth you're seeing.
Sure. I mean, I think there were two things that really created a lot of awareness and acceptability around virtual care and pharmacy, which is kind of how I look at telehealth. One was the pandemic, and then the second was GLP-1 medications, right? I mean, Lilly and Novo launching their direct-to-patient self-pay programs, which are just, changing the kind of way Americans access pharmaceutical products, has been a game changer. And, what it's done is it's created a lot of amazing, virtual healthcare and pharmacy platforms, and it's created a lot of kind of lower quality platforms.
So when you look at the landscape, what do you try to do to create one that is higher quality? Because there is a lot of competition out there.
Sure. I mean, there's hundreds of companies, right? Maybe even thousands of companies. So, the biggest differentiators for LifeMD as a platform for virtual healthcare and pharmacy, one, we rely on mostly full-time providers. A lot of the big companies, when you think of the legacy term telehealth, it's an army of providers. And those providers, a lot of them are high quality, but it's, oftentimes they're not specialty trained, right? Sometimes they're doing this in the evenings and weekends to make extra money. The big difference with, the most important part of our service offering at LifeMD is delivering amazing healthcare. So for us, having these full-time providers that we can train and make sure it meet our quality standards and are interacting with our patients, that's the biggest differentiator for our company.
So they're all staff, they're part of the team.
Exactly, not all of them, but the majority of them. Our model at LifeMD is built around recruiting, training, and retaining incredible providers.
Justin, one thing I was curious about, and looking at some research about the growth of telehealth, they said, in terms of segments, psychiatry was the largest revenue-generating disease area last year. It was also the most lucrative disease area segment, registering the fastest growth during the forecast period. So I'm curious, on your platform, is that a big component? Or is it, like you said, GLP-1? And if so, how much does GLP-1, is that type of business on your platform?
It's a good question. I mean, we do have a virtual psychiatry offering. It's smaller.
Okay.
And the reason for that is, quite frankly, the demand for GLP-1 medications, as you know, has been off the charts. The number one reason a lot of Americans end up at virtual care providers is for a prescription medication. And so, we built this amazing platform for delivering longitudinal healthcare and pharmacy. The whole GLP-1 opportunity presented itself a couple years ago when Oprah Winfrey first kind of got behind these medications, created a ton of awareness. And we were one of the first companies to recognize, even when a lot of our larger peers were discrediting these medications, we were one of the first companies to recognize that this was going to be a game-changing class of therapy, and we went all in on it. And it's enabled us to take, our platform from, a very small number of patients to today, LifeMD has approximately 350,000 active patients across all 50 states.
What's the next GLP-1? And I ask that in the sense of what's the next inflection point for telehealth?
Well, a lot of additional GLP-1s and I think a big kind of unmet need in that market. So, fewer than 15% of Americans that qualify for a GLP-1 are on one. I think another big area is women's health, hormone therapy. In men's health, there's a lot of talk around descheduling testosterone therapy. You also have a lot of new peptides that RFK is talking about bringing to market, which could be, and that kind of ties into the whole longevity space, right?
Yeah.
I mean, I think, longevity as a whole is going to continue to be a massive space for us.
What determines whether or not you offer something? Because some of the things that he has talked about don't necessarily have the clinical data or the randomized controlled trials to back them up at this point. So what does it take in order to say, okay, we will offer these?
I think that's a great question. It's one I've personally wrestled with. A lot of our competitors have offered products to date that are most likely safe, but where there was no large controlled clinical studies around, right? And personally, this is something that I care deeply about. So I think, look, most important is safety, right? Our clinicians, our kind of independent clinicians, need to really feel like a medication is safe. After that, I think the second thing that they'll look at independently of the business side of the platform side of LifeMD is efficacy data. And I think there's like this kind of in between that I've been thinking a lot about personally, where some of these things like peptides, which are already being used by large numbers of Americans, you do have a lot of safety data. A lot of them are almost feel more like a prescription supplement offering. Right? And so it comes back to safety, right? Like we're never going to make claims like efficacy claims about, one of these medications. First and foremost, we're going to want to make sure that they're safe. And then we're going to decide whether, it's something that we want to attach our brand to.
How much of your business is related to GLP-1 drugs?
Yeah, right now it's about 60%, 60+% of top line revenue is related to GLP-1 medications today.
Because I am curious, like you guys reported earnings, there was some disappointment over your guidance, and is there more that you can share about the business and the outlook as to why you think investors may have had it wrong? I said your stock is up a lot, but the stock sold off following that. What do investors need to understand?
I mean, our business has been going through over the last couple of quarters a bit of a transition. Early on, we had a lot of patients that were on compounded GLP-1 medications prior to these drugs coming off of the shortage list. When they came off the shortage list, we basically formed collaborations with both Eli Lilly and Novo Nordisk, which I still believe was the right thing to do long term. However, like it's less profitable for us than certainly a GLP-1 medication. So the answer to your question is, we're focused on building durable revenue streams. Sometimes that means getting a little bit less revenue up front, having a better value proposition for the patient, and it takes a little bit longer for that to materialize. And so that's what we've tried to guide to our shareholders, and I think most of them really understand that.